You know, I'm most proud of the difference we're making for children and families. To save families from the pain of having one of their children hurt, seriously harmed by being in one of our hospitals, that's an incredible gift and an incredible commitment, and certainly our responsibility.
As a senior hospital leader, you're invited to share in a great opportunity, perhaps the best of the year for SPS Network Hospitals. In September, leaders from more than 100 children's hospitals will gather at a learning session dedicated to the SPS principle of all teach, all learn, through our agreement that we will not compete on safety.
That there was an agreement by the CEOs in the children's world not to compete on safety, meaning that we're not going to compete in ideas. We'll compete in execution, but we can all learn from one another about what best practices are, about what's working, what's not, and most importantly, how to bring the culture of high reliability organizations into the healthcare system in a way that hadn't been done before.
At the session, senior leaders will explain the theory, journey, and multi-year plan to significantly reduce serious harm across all children's hospitals. Demonstrate the critical role of senior leaders in children's hospitals and highlight the effect on safety performance. Discuss specific best practices that senior leaders will be able to implement immediately that have been shown to improve culture and reduce serious harm. And discuss solutions from peers to overcome key barriers to success.
You know, all of us who've been entrusted with this great responsibility to care for children, to help heal children, to give hope to children and families, it is a huge privilege. And I think because of that, this idea that we're not going to compete on safety was an easy one for us to rally around, because we know that working together we can make such a huge difference for children and their families.